Welcome to today's session on the interview series for going beyond survival to long-term sustainable holistic wealth. So I'm so glad, I'm so happy that you are here today. And my greatest intention is that you get something of value for yourself today. I hope that you get something useful. So I'm speaking to the in the studio here, and I am not able to see who's here and who's joining. Now that whoever you are, has already joined now, welcome. It is a great pleasure and honor for me to be with you. In a short while, we'll be going live. That will be in about 3 minutes. We'll be going live. So welcome, come in. If you have any other friends that you believe will be benefiting from this topic, the topic today is on preventing heart attack, stroke, and diabetes. So that's the topic for today. If you have any friends out there you believe that will gain some value, usefulness out of this topic today, just invite them in. Just give the link to my Facebook page where we are streaming live. Bring them in so that we can get as many people as possible to benefit from here. And I'm so excited to be speaking to you. And I'm only going to be speaking to you just for a short bit because the rest of the session, I'm going to invite our guest for today. And our guest for today is, I will mention this again afterward, is Professor Dato Dr. Mafauzy Mohamed. I'll be referring to him as Dr. Mafauzy. He's the Professor of Medicine and Senior Consultant Endocrinologist at the Hospital Universiti Sains, Malaysia. What we are doing in this series is we are having people from various expertise to share their expertise so that we can bring the various dimensions of how this crisis, this COVID-19 crisis is affecting us. Because the tendency, the reason why I'm having this series is that the tendency is that we may just be looking at it from one perspective, whereas what we have discovered is that this crisis, COVID-19, is affecting us in many different dimensions. So that's why I've invited experts from the area of mental and emotional health, from the area of finance, from the area of wealth creation, from the area of business, from banking. And today we have an expert from the area of medicine. So that's why I'm so stoked, I'm so excited to have this session, that we may gain valuable insights and information, not just for the sake of information. What's important is that from what we gain, we are able to take baby steps, small steps that will enhance our wellness, our well-being in the various areas. So it is already 11, time for us to begin. So with that, I would like to bring to the screen our guest for today. So this is Professor Dato Dr. Mafauzy Mohamed. So Doctor, welcome to this interview today. Just for the benefit of our viewers, there is a slight lag in terms of the video and audio. So I will be speaking slightly slower and be waiting for some time for our guest to respond. So again, Doctor, welcome to our interview today. I'm sorry. Yes. Sorry to cut you in because Yeah, because I did not get the audio just now. So again,
Right. Assalamualaikum and good morning, ladies and gentlemen. Thank you very much, Key, for that introduction. I'm also very happy and very pleased to be sharing this platform today.
yes, so we are experiencing audio lag. So what I will be doing is that I will be just be asking a few questions, and during this interview, I will invite give.
Okay.
I,
I repeat, okay. Assalamualaikum and good morning, ladies and gentlemen. Thank you very much, Key, for that kind introduction. I'm also very pleased and happy to be sharing this platform today and sharing on this topic.
Okay, thank you. So what I will do is that because there is a long audio lag in this session, I will be asking as few questions as possible, and I will be giving the stage, so to speak, for Dr. Mafauzy to be doing more of the explanation in order to not have that conflict of audio coming in. So again, welcome to this interview. And for the benefit of the audience here, that in this series, we invite experts from various backgrounds to inform about the impact of the crisis from their own expertise. So what we are doing is we are bringing valuable people with valuable information to help us to go through this crisis in a more healthy way. So if I may start off with the first question, is that in the context of the topic that you have chosen, it is about preventing heart attack, stroke, and diabetes. So in the context of the present crisis, what is the relevance of this topic in the context of the crisis that we're facing right now? So over to you.
It's a disease, common chronic illnesses that are affected, that causes death in people with COVID-19, hypertension, diabetes, and heart disease. So in this context, it is very important, first of all, that we need to protect people who are elderly or people who have the diseases that I mentioned, hypertension, diabetes, and heart disease, from being infected in the first place. Because if they are infected, then they have a very high chance of getting into serious complications and even death. Okay? Our own data showed that 44%, about 45% of people that died have underlying hypertension, and about 1/3 of the people that died have underlying diabetes. So these two, and plus also about another quarter of people that died, over 1/5 of people that died have heart disease. So these are very important so-called conditions that if they do get COVID-19, they're more likely to have serious illness, uh, or they may even die because of this infection. So in terms of what do we need to do for people who suffers from heart disease, from diabetes, and also hypertension, is firstly we need to protect them. Yeah? How do we protect them? One is, of course, these diseases that are transmitted from people to people. So essentially, they need to stay home as much as possible. Okay? They need to reduce the risk or other people, and other people may be carrying this virus, they may be infected. And one of the things that we know about this virus is that this virus can occur in people without any symptoms, so-called asymptomatic. They don't have any symptoms such as fever, no flu-like symptoms, and so on. And they go about their daily lives normally. Right? And when people with high risk get in contact with these people, then the virus can be transmitted to them. And since they have other conditions, they may have, they can suffer a serious illness because of this. So one is that they need to reduce contact with other people, i.e. stay home, don't go out unless it's very urgent or very is a real necessity. And if they were to go out, example, if they were to go to the hospitals, for instance, or go to the pharmacy because they need to collect the medications or see the doctors, then they have to be very cautious about the so-called maintaining the physical distancing or so-called social distancing that we talk about, i.e. be more than 1 meter away from any other person we're talking to. Okay? Do not have any physical contacts with with these people, such as handshakes and so on. And of course, important for them to wear mask, because masks are important because it will prevent the droplets, because this virus are mainly carried in the droplets. Because when we speak, for instance, where there are droplets, so-called respiratory droplets that come out from our mouth and from our nose, and this can infect people. Yeah? So important for them to wear mask. It's also important, I think, for other people also to wear mask, even if they don't have symptoms. It's not so much that to prevent them from getting infection, but they may be carrying the virus, okay? And they may not have any symptoms. And if they wear masks, then then they reduce the chance of them transmitting the virus to other people, i.e., we wear masks not to protect ourselves, but to protect other people from getting the virus. So important to wear masks if you go out in a crowd or confined spaces because of that. But still, the best is actually to stay home, only go out when it's necessary, and even when you're at home, suppose you have to restrict your visitors, right? I.e., even if your own children or your relatives were to come and visit you, I'm talking about patients who have multiple themselves, this disease to be under control. Okay? And the control means your blood pressure is well controlled on medications, your blood sugars are well controlled on medications, and more important that because you are probably less likely to get into severe forms of disease. And can be really controlled. So, or even death.
I seem to have lost audio right now. So the 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 percentages that you gave just now.
Okay, right. I've stopped talking for a while.
Okay. Okay. So I'm just asking about the percentages you mentioned. Very high percentages of people suffering from hypertension, diabetes, and heart disease
Right. Yes.
that died due to COVID-19. So what's happening there? What is causing these people to be highly what's the word that we can use to be highly susceptible to COVID-19?
Right. Well, COVID-19 being a viral disease, what happens is that once the virus gets into our body, then the body normally responds by
Yeah, I think we have lost connection with Professor Mafauzy. In that case, what I will do is I will check out with him with respect to his connection. The other option that I'm thinking about is to do an audio interview. But let me just call him for a moment and see what's the status. Hello, Z. Hello. To Dr. Mafauzy. Uh, Hello, can you hear me over there?
Okay. Hello. Hello.
Hello, Z.
Hello.
Hello, Z.
Hello. Okay.
Hello.
Hello.
Hello. Hello, Z. Can you hear me? Okay, can you hear? Okay, so what we are doing is that because there is this audio lag, we can continue on the interview because now I'm picking up your audio from the phone. Okay. Okay. So we can continue on the interview. So I'm going to stream your voice. So all right. Okay. Okay. So let's get back to that question that I asked regarding the percentages. You give the percentages yang 45% hypertension, 30%. Hello. Can you hear me? Yes. Hello. Okay. Yeah. Yes, I can hear you. Okay, so regarding the percentages, you mentioned that very high percentages dying from people with hypertension, 45%, diabetes, 30%, and heart disease, 20%. So what is the word would be, what is the uh, process that's taking place that's causing these people to be so uh, susceptible in this situation?
People who have underlying disease illness such as hypertension, diabetes, and heart disease, and other illnesses, if they happen to have kidney disease or even cancer, these people, they tend to have a lower immune response compared to persons who do not have any of these illnesses or who are young. And the process when the virus gets body, it eventually comes in with antibodies, which neutralizes this virus. So in the person who have a strong immune system, then they're able to take care or get rid of this virus or neutralize.
Okay. So
then they're not able to mount a strong antibody response to the virus, and hence the virus actually damages the lungs and other tissues more compared to a person who have a better immune response.
Okay. Yes, and I was also reading about blood clotting, that this COVID-19 is causing blood clotting. What is happening there?
Yes, it's the same thing, because what this virus normally sticks onto the cells of the lining of the blood vessels. So also it also sticks to the linings of the lung. That's why it causes pneumonia. It also can stick to the linings of the blood vessels. And once the lining of these blood vessels are damaged, then that initiates what we call clotting system. When our blood, when it get into contact with some damaged tissues, then it will have a cascade of causing blood clots. So this is one of the mechanism where you get blood clots being formed in the blood vessels because of the damage of the lining of the blood vessels due to this virus. And of course, the blood clots can go on the lungs, can go and causes the so-called the acute respiratory distress syndrome in the lung, where there's not enough oxygen being entering the blood vessels because blood clots, the vessels are clotted. It can also cause strokes because the blood clots that's reduce the supply of blood going to the brain. And in children, also it causes blood clots going to the legs. So the so-called Kawasaki syndrome you see in children. That is also in relation to the formation of blood clots as one of the mechanisms behind that.
Yes, can you speak a little bit more about the danger to children in terms of the Kawasaki syndrome? Because initially we thought that that COVID-19 is very dangerous to the elderly, and now we are beginning to know that it is also very dangerous to children. So can you please speak a little bit more about that?
Well, it is still very rare. Even though it's been noted, but it is still a rare sort of syndrome.
Oh wow! Okay.
What it does is so-called is inflammation of the blood vessels. Of course, you know, blood vessels is everywhere. It goes on every organs in the body have blood vessels. So if you have inflammation of the blood vessels going to the brain, going to the heart, going to the kidneys, then you have diseases of this type. So Kawasaki syndrome is a multi-organ disease failure due to the inflammation of the blood vessels because of related to COVID infection. As I mentioned, COVID virus can stick to the blood vessels and it cause the blood vessels to be inflamed and disease, and cause blood clots, inflammation, and so on. So even though it is it's been talked about, but it's still rather rare, and it's something that there are treatment available for it. And if it's detected early, it can be treated, and many of them actually survive the treatment. unlike, of course, in the elderly, they tend to, despite the treatment, many of them actually die. But children, I think, if they are treated early, they diagnosed early and treated early, many of them actually can survive.
So it seems to me that the best option for the elderly is to just stay away and stay safe.
Until and unless we have a vaccine available, then it is best that to prevent ourselves from being infected. Okay? So prevention, in this case, is prevent yourself from being infected. And as we all know, that this disease transmits from people to people. So essentially, you need to minimize contact with people. That's why the word social distancing comes in. Even though I don't actually like the word social distancing, because it means that you are essentially trying to get physical distancing, i.e., decrease the physical contact from one person to another. You still can have social contacts. Nowadays, you can use video calls, etc. Okay? So, personally, even WHO also recommends to use word physical distancing rather than social distancing, because social distancing means you can connect to other person, and obviously when in this so-called lockdown, one of the effects of the so-called lockdown is stay home with that. A lot of people now get depressed because they can't be in touch with other people. So I think the better word to use is actually physical distancing rather than social distancing. So I tend to use the word physical distancing because that's the main thing. You want to be physically distanced from another person because that's how the virus gets transmitted. But you can be socially close to a person. Video calls, with social media nowadays, you can still be close to another person.
The languaging here is very important, because when you mention about your preference to using the word physical distancing, that makes a lot of sense to me, because we human beings needs to be socially connected. If we are not socially connected, then we might get into emotional stress because of that. So when you use the word physical distancing, then that creates a greater specificity. Okay, I keep a physical distance with my loved one. At the same time, as what you mentioned, is to keep social closeness through video calls or audio calls. Is that what you are referring to?
Yes, that's right. Yes. The main thing is physical distance. Social you can still maintain social closeness through a lot of social media now. As I mentioned, even the World Health Organization (WHO) recommends that we use the word physical distancing as opposed to social distancing, because it carries a different connotation. Social distancing means you need to be socially isolated, whereas physical distancing means you only need to be physically isolated, but you can still be close socially through this social media.
Okay, so that gives a greater clarity with respect to people with high risk, that what they can and not do. So what additional precautions do people with pre-existing ailments need to make?
So as mentioned earlier, people with any conditions, any health condition, then they need to be, first of all, until and unless the vaccine comes in. The reason why I'm emphasizing the vaccine, it's not only me, but I suppose a lot of other people also emphasize the vaccine, is that once you have the vaccine, then when the virus gets in, then the vaccine will prime your body to produce these antibodies. So these antibodies will now attack the virus, and makes the virus relatively harmless. So you are more likely to get less serious illness. And you have to remember that about 80% plus of people who gets this virus, they tend to have very mild symptoms, i.e. just a bit of fever, maybe a bit of cough, and muscle aches, and after about 2 weeks or so, it disappears. So, but in certain populations, I mentioned those at high risk, they are the ones that go into more serious problems. So, the vaccine, by helping the bodies to mount an antibody response to the virus, makes the infection milder. Okay? It will probably not protect people from getting a viral infection because the virus is more or less everywhere. You inhale the virus and then it touches on the respiratory system, but if it gets into your blood, your antibody will take care of it. But as long as it remains in, say, just your nose or back of your throat, then it's sort of like a mild flu symptoms that you get. So I think the vaccine will probably make it people who were to get infected, okay, especially the high risk people, then the infection tends to be milder and not serious that can cause them death. Okay, so perhaps when the vaccine comes in, then people can be a bit more open. Open means they now a bit more fear to go out. But even if they were to get infection, then this infection will probably be milder for them. It's the same concept like the flu vaccine. That we encourage people, the elderly, and those with chronic illness, as I mentioned, like diabetes, heart disease, for instance, or cancers, for them to have the flu shots. Simply because if they would get a flu, then chances are the flu will be milder. Because the flu can also be quite severe and can cause death in these people, especially if they're not vaccinated. So it's the same concept we're talking about, like the flu vaccine, that you probably also need this vaccine against the COVID virus to prevent you from getting severe illness.
So we are back to that similar scenario. If we want to look at the similarity, it's about protecting people who are at high risk, because people who are at high risk, when they contract this disease, the symptom is so much severe that it leads to death. Yet the people who are at lower risk, what they are experiencing is lesser in terms of the impact, and that is how they are able to survive the disease. Is that what you are referring to?
Yes, that's exactly is the situation. As far as this infection is concerned, healthy people who do not have underlying illness, younger people, then if they were to get this infection, then the infection tends to be mild. Whereas elderly people who have underlying diseases, then they are the ones more likely to have severe disease and to die.
So does the current statistics point to this? I mean, for example, in Malaysia, we've got quite a high recovery rate. So there is the number of people who die. So does the number of deaths relate to a higher percentage of people who are from the high risk group?
Yes, I would think so. Yes, simply because I think the younger people and the healthier people, they tend to go out more compared to the elderly and people who tend to go out less. And they stay at home. So that's why the younger, healthier people, they go out and they contract the virus. And the problem is when they come back to the house, then they may actually transmit this virus to their elderly parents or the sickly parents or grandparents or relatives. And these are the people that actually die. As I mentioned, when we look at the people that die, most of them contract the virus at home, or rather in places where it's thought to be fairly safe.
Mm-hmm.
So that is the reason why it's important that we take care of our people who are at high risk, the elderly, those. And if you look at the data from the West, Europe, and the US, North America, for instance,
Mm-hmm.
the majority of deaths are in nursing homes.
Oh.
More than 50% of people that die.
Okay.
Are in the workers of these nursing homes bring in the virus to them. Okay? And once the virus gets into a nursing home, people at high risk then spreads like wildfire.
Okay.
For that.
Okay.
And of course, in certain countries, for instance, what they have discovered that these nursing home people are obviously very frail and are sickly. And sometimes they go to the hospital for treatment. They need to be hospitalized for a certain duration because of the acute illness. And they contract the virus in the hospitals. And when they bring back to the nursing home, then they spread it from there. And the spread is probably not from person to person, but the workers that attend to this patient spread out to another person and another person.
Okay. So sorry again. So what recommendation would you can you give to one is to the people at high risk and two is the people at large. So what recommendations, for example, if a person is in the high risk group and beginning to experience symptoms, so what would you recommend for these people?
Immediate medical attention. That they need to get the doctor's procedure now, and then perhaps they can be diagnosed quite fast nowadays with the testing. You can get the results within a few hours, and then if they are positive, obviously they need to be isolated and treated. Then there are ways and means of giving them treatment so that they do not progress to a more severe type of disease. So immediate treatment is warranted. So they need immediate medical attention.
So if they need immediate medical attention, so do they contact the nearest hospital or clinic? Or so what would be the process there?
Yes, in our country, we probably need to go to the nearest clinic to be examined and tested. Once they are found to be positive, right, then they will probably need to go to hospitals where they will be warded or admitted to a specialized ward, so-called isolation ward. Then from there, and in there, they will be taken care of by the healthcare personnel.
So what advice can you give to people in order for them to stay on top of the, what I mean by on top is to be continually to be informed, because as people go through social media and all that, so many unsubstantiated claims about COVID-19 come up every now and then. So what can you suggest or advise people in this current scenario?
I think first of all, when you have any information or you receive any news, to verify the news first, and then see whether it is authentic, it's not fake news. The best is actually to nowadays many of the established bodies such as our own Ministry of Health, the World Health Organization, if you're talking in the US, the Center for Disease Control, is where you can get correct information updated. Okay? And the way that they have presented their data in the information, if you look at it, it seems to be very simple and easy to understand by the layman. So I would think that if you were to have any information or news, rather than quickly send it to somebody else, check the facts first. Because sometimes if you were to spread wrong information, okay, that can cause harm, not only to the person or even to other people. So it's very important for us to get the facts right before you spread news. Okay? It's not very easy for people to just to share it or to forward it to somebody else and not checking, verify the news first. Okay. So very important to do that.
Right. Thank you. So I have a question here from Sumaya. The question is there a spike in heart and diabetes cases during the MCO, and are they somehow related to COVID?
Well, we probably do not have the data yet, but our own suspicion is that yes, okay? There are two reasons for it. One is that patients who do have some underlying conditions, okay, may actually delay from going to see the doctors or the hospitals because they're worried about getting this virus. So because they know that the virus is probably highest in the hospital, because that's where the sick patients are. So they may delay getting treatment. So there are many cases where they can get heart attacks or their blood pressure and their diabetes are not controlled because they don't go to the doctors. They avoid going to see the doctors in the clinics and the hospitals. So that there have been cases where there's heart attacks and so on because of that. So yes, it's important that if people who have hypertension or heart disease or diabetes, do not miss the appointments with the doctors, even if they can't physically go to the doctors. There may be a way that they can contact the doctors or the nurses through WhatsApp or phone call, at least get the advice from the doctors. And perhaps for the medications, if they're worried about going out, then get the children to get the medications for them. But do not, in any instance, run out of medication because that may increase your risk of getting more severe disease during this COVID pandemic.
That's an interesting point that you mentioned, that under the current circumstances, people are fearful of going to hospitals because of the risk of contracting the disease, because that's where people are being treated for COVID-19. So in your own practice, are there a number of cases whereby your patients are delaying seeing you because they are afraid to go to hospitals? And what steps do the hospitals make, for example, USM, that make it easier for these people to get at their medication?
First, we do say that if you need to see the doctors, go and see the doctors in the hospital. Because the hospitals, the way that they've been designed, they will make sure that people who are hospitalized for the COVID infections are essentially stay isolated. There are very minimal risk of them transmitting the virus to another patient. And they say a special building or special wards where the risk of them transmitting to another patient is less. So if they need to go to see the doctor, then they can still go and see the doctors in the hospital, because the hospitals will make sure that patients who do not suffer from COVID do not get COVID from the hospital. And we have that in place. So that's one. But patients can still come and see the doctors in the hospital if they want to, if they need to. And certain medication, if patients are fearful of coming to the hospital, but they have like a blood pressure machine or a meter to check the sugars at home. But as long as they know that the blood pressure is fairly stable and the blood sugars are fairly okay, they just want to continue the medication, then what they need to do is just probably call the clinic or get the children to go to the clinic to get a supply of the medication. The doctors can prescribe the medication, and the children can take the medication for them and bring it home. So that is another alternative for patients who are fearful of coming to the hospital. But whatever it is, we keep telling our patients that make sure that you do not run out of medications. Take your medications on time to make sure that your underlying disease, hypertension, diabetes, or heart disease are fairly stable and very well controlled during this period.
Okay, so I would take that as a very powerful advice to give to people with pre-existing hypertension, diabetes, or heart disease is to be current on their medication, not to lapse, so that they can stay in shape, they can stay well during this period. And that it is okay for them to go to hospital because the hospital have separate means of treating the COVID-19 patients, and that people coming to hospitals for other treatments, hospitals are operating as per normal. Is that it?
Yes, we will make sure that obviously we can also tend to, for those patients that do not need to see the doctor that frequently, we normally reschedule the appointment.
Okay.
Again, essentially, the main thing is to prevent people from coming over too many. We don't want to have also an overcrowded hospital.
Okay.
That may, it's not so much that the virus is in the hospital, but patients coming in, they bring the virus, and can infect other patients.
Okay.
So it's not so much.
Okay. So that social distancing needs to be the physical distancing needs to be fully observed when they come to hospitals.
Right. I think that's very important because we know that for sure the one that has been able to reduce this transmission of the virus is really the so-called physical distancing. So even when we were to go out, as we were now talking about the exit plan, exit strategy coming out from this so-called lockdown. Even in Malaysia, our PKP or CMO, control movement order, is a form of lockdown, i.e. we are restricting people from going out so that they can reduce the interactions with other people. The most severe will probably be curfews, where you don't allow people to go out of the house. That's been implemented in some countries. Then, as we go out of this so-called lockdown strategy, we need the exit strategy. We need to now to have people going to back to work because people need to go back to work for their livelihood. People also need, children also need to go to school and the universities. We can't be shutting the schools and the offices and the businesses until the vaccine comes along. That will be disastrous. So when we come out to get businesses to open, people go back to work, kids go back to school, the universities and so on. I think the main thing is that to make sure that whatever they do, that they maintain that physical distancing, so that you reduce the risk of virus transmission in this situation. This is what we call the so-called new normal. What is the new normal? That you can probably go to crowded places like before, you can hug people, you can shake hands with people. You probably will not be able to do that, at least for the time being, until perhaps the vaccine comes along.
So when we talk about the opening up of society, of businesses, of the economy, so we have to my mind two stages. The first stage is the current relaxation of CMO, where we do not have the vaccine yet, and the vaccine will only come later. So what are the matrix or parameters that the health authorities looking at as we begin to open up the economies again?
I think the main thing is to ensure that in workplaces and in schools and universities or other people, or places where people go, that they maintain the physical distancing. So and also try to avoid overcrowding. Okay. So that's the one thing that people have to ensure. But, the employees have to make sure that, okay? And the schools have to make sure of that, and so on. Okay? Make sure that people maintain a physical distance between one another, avoid overcrowding. So that's one. I think for the health authorities, what they need to do is to make sure that to prevent the spread of the infection. We probably will not be able to stop an infection because the virus is around. I think the reason why we are not able to perhaps get rid of this virus that we were able to get rid in other viruses such as the SARS virus before or the MERS-CoV virus before, is because this virus can exist in a normal person. People have this virus, they don't know they have this virus, and they can spread this virus. Whereas in people in the other illnesses that I've mentioned, when the virus gets to the person, then the person normally have symptoms, so we can catch this person and isolate them and prevent them from spreading this virus to another person. Whereas this COVID is slightly different. So you will probably be with us for a long while because back then people can have this virus, they don't have any symptoms, and because of that they transmit another person. So for the health authorities, the main thing is that once they have identified a person who have to be carrying this virus, that it's important for them to isolate these people immediately, so that they don't spread the virus to another person. But more importantly is that we also need to know who this person has been in contact for the last few days. Because this person that have been in contact with this person, this case, in that case we call that, can have this virus and they have the potential of spreading the virus, be a spreader as well. So we need to catch this close contact, to trace them, to test them, and even if they're negative, if they have a history of being in contact, they need to be quarantined, i.e. for 14 days, so that if they do have the virus, then they will not be spreading the virus. This get contained within in the home. So contact tracing is important to prevent spread of the virus. So for the health authorities, they have to be very vigilant in contacting, in tracing the case and tracing the context of the case to prevent transmission of this virus. So I think that is the duties of the healthcare profession.
Okay.
But as a person, more importantly is that try to maintain physical distancing as much as possible.
Okay.
Because it's maintaining physical distancing that you can prevent the virus from getting to you, but also from if you were to be carrying the virus and you don't know that you're carrying the virus, from transmitting this virus to another person.
Okay, thank you. And probably this will be the last question from Smaya here. Where can we get legit reading materials with regards to the virus? Because information flood is getting confusing. I mean, many countries are testing for the vaccine and all that. And we read news about great news here, great news there. So where can we get the legitimate reading materials with regards to the virus?
I think in Malaysia, you can go to the Ministry of Health website or the Facebook. They do have quite good information there. The World Health Organization also have very good materials on their website, on their Facebook as well. And as I mentioned, even the CDC, the Center for Disease Control in the US, also have very good materials for the public. So I think all these organizations, they make sure that the information that they provide is also for the public, not just for the health professional.
Okay.
Obviously, the terms about the vaccine and all that, only the health professionals will be keeping up closely with it. Yeah? Because we know that the vaccines, the earliest will probably be in about a year's time. Because the fact that as we have a vaccine, that you have to go through several stages of testing. Because we want to make sure that not only does it work, okay, we also want to make sure that it's safe. The main thing is make sure that the vaccine or whatever treatment that we are giving to a person is safe. There's no point giving a medication or treatment which works, but it's not safe. People die from the treatment rather than die of the disease. So very important for us in the medical profession that we make sure that whatever we give to the patient is firstly safe. Secondly, of course, it's effective, works. Then of course we need to have that confirmed by so-called trials and so on.
So that is very useful, because if I were to reflect back upon my own personal expertise, previously I was an expert in the area of engineering, and as an expert in that area, I do know that many people don't know what I know. And that's the value of expertise. So in the context of medicine, I am not an expert, and because of that, I want to rely on instructions coming from experts, because they know more than what I know. Even though I may be reading lots and lots, but there are experts who are able to understand it better. And as you mentioned, the experts are there in our in our health ministry, in WHO, and so on. So those are the sources that I want to go to instead of social media sources. Is that what you are saying there?
Yes, that's what I'm saying. Always refer to the so-called the reliable sources where they make sure they probably ensure that whatever facts they put on the webpage or on the Facebook are actually correct, not something which is rumors or something which is still being tested and so on.
So before we end this session, what 1, 2, or 3 points that you want to highlight with respect to the health in terms of people with heart disease, hypertension, and diabetes? So what 1, 2, or 3 points that you want to highlight as parting points to the audience here?
Okay, so first of all, if you were to suffer from any of these diseases, then it is very important for you to prevent from getting infected by this virus. Because if you are infected by the virus, then you're more likely to get more severe disease or even death. So the best way of protecting yourself is, one is to reduce your contacts with people, because people carry the virus. So i.e. possible stay home, don't go out unless it's very necessary, very urgent, to get your supplies, your necessities, or to get your medicine to your doctors. And also, if people come to visit you at home as well, also ensure that there is some physical distancing between you and the visitors that comes and see you. So that's number one. Number two is that ensure that your chronic condition, blood pressure or your diabetes, is well controlled by ensuring that you take the proper medications. Don't run out of medication, and of course, if there is a need for you to comply to the other measures such as your diet and so on, let's comply to these measures to make sure that your blood pressure, your diabetes or heart disease is very well controlled. Because if they're not controlled, then you also run the risk of getting into more severe problems if you want to get the disease. So those are the two important aspects that people with these conditions needs to be aware in these so-called COVID times.
So thank you very much for your gracious sharing of your time. And I know that the time that you have allocated to being here is very precious, because we saw in the background that you are giving this interview from your office at work, and you are taking valuable time to be with us here. So I really appreciate that. Thank you very much. And also I appreciate the fact that you are so flexible enough that when we lost the video, we are able to continue the interview just using audio. You are game for that. So I really appreciate that. So thank you again, Dr. Mafauzy. So,
pleasure, King.
Yeah.
You're welcome.
Right. Thank you. And for the viewers here, I would like to also thank you for your patience, for staying with the interview. Even though we've lost the video, you are still here for the interview just with the audio. So congratulations to you. Give yourself a pat on the back for doing that. And I hope that you've gotten greater clarity with respect to our medical health in this context. So I hope that that interview has been useful for you. And before we end this session, just like to remind you that tomorrow the session will be at 10:30 in the morning Malaysian time. We'll be having Rajan Devadesan. He'll be talking about from the aspect of wealth management. So very interesting topic, failing, surviving or thriving, at 10:30 in the morning in Malaysia. So tomorrow we will have Rajan Devadesan to speak about that. So if you have friends who have not registered, please ask your friends to go to the link that we have shown on the screen, so that in the event that any of our guests were to give additional information, we will just email them to you. So with that, I thank you again. I really value your time. I hope that you have gained something of value to you, and I look forward to seeing you in the session tomorrow morning. Thank you very much, and stay safe, stay home.